What's going on, everyone? Sidney Gordon here with the Sidney Gordon podcast powered by Core Medical Group. Today we have Ashley Zimbler, one of Core Medical's nurse practitioners. And our main goal here is for you guys to get to know our internal staff, especially our medical team, which is the most important part of Core Medical, either before your telehealth visit or even before coming aboard. So we have a whole entire series of Meet Our Staff that we do through these podcasts. So Ashley, thank you so much for coming on. I'm very excited to have you. And I know we haven't had that much contact together, but we'll have a nice 45 minutes together today.
Perfect. Nice to see you. I'm excited to be here.
Cool. So Ash, we start this stuff off always by just kind of talking about where you're from, a little background on yourself, and just to kind of let the people know your background.
Yeah. Yeah. So I am originally from Kentucky, Northern Kentucky. Grew up in a big family, youngest of six. Always have been around healthcare. My dad is a surgeon. My brother's a surgeon. Mom's a nurse. So been very involved in the medical community since I was young. I was scrubbing in with my dad. So I always knew I wanted to go to this route. I was a nurse for about 5 years before going back to nurse practitioner school. I worked in oncology. So, coming full circle, always looking at our patients' PSAs, their prostate levels, always keeping an eye out for anything, abnormal, because that's such an important part of my history. And I've seen it so many times that it's something that I always look for. After being in oncology, when I went back to school, I studied family nurse practitioner. So I started in like an urgent care type setting, and I worked with a broad spectrum of medicine. It was good to do for about 2 years. Kind of, gets old with just prescribing antibiotics. And I feel like I wasn't truly helping anyone get better. It was more just fixing, putting a Band-Aid on the issues rather than getting down to the root cause of what's going on in their body. So after that, I knew I wanted to go into some type of hormone therapy. I started doing hormone therapy with pellets, which is a different type of hormone therapy, but basically it's a procedure where you insert a testosterone pellet into someone. It's released via cardiac output over 3 to 4 months. So I did that, saw a lot of ups and downs with people, and I knew I wanted to delve deeper into testosterone therapy and hormone therapy for females as well, and ended up at Core. So I've been here for about 1.5 years.
What kind of surgeon was your father?
He was an oral maxillofacial surgeon. So a lot of wisdom teeth and implants and things like that.
Really? So are you still in Kentucky?
So I am in Denver, Colorado right now. I've been here on and off for almost 10 years, but go back to Kentucky a lot, and was at the Derby a few weeks ago, which was fun.
Nice. I spend some time in Kentucky. I'm a big bow hunter, so I travel all over the place. Kentucky's one of my stops every year, towards the end of October. And Denver is too. Steamboat Springs actually in the second week of September every year I'm there. So that's interesting. So let's start off by talking about what is important to you when you have that patient on the phone for the first time. So just so you guys are aware out there, when you come through Core Medical's process, you're responsible to get a telehealth visit and blood work at a minimum of every 8 months. So you come through the door, we get your blood work done. If there's no existing conditions, anything that we're concerned about, you're in good health, we're going to ask that you get your blood work done at least within 6 to 8 months of that period of time. Sometimes the practitioners are asking to get it done, after the first 20 weeks of protocol, so on and so forth. That's up to the practitioner. But you're seeing patients that are brand new, and you're also seeing patients that are reoccurring. So talk to us a little bit about what to expect as a brand new patient coming through the door at Core Medical and landing on the phone with you.
Yeah. So I think one of the first most important questions is just, why are you here? Are you here? Are you interested in peptides? You just want a baseline of what's going on? You're here just strictly for hormone therapy. So I think always getting their point of view and our patient's point of view of what specifically they're here for, I think is important. Um, After that, we see how long symptoms have been going on for and get a really, really thorough medical history, not only on yourself and what medications and supplements and vitamins you take,
Hmm.
but also family history. Do you have any family history of heart disease or cancer or anything like that? It all plays such an important role in, you know, what how we can help you and how we can get you to, feeling your best and optimizing your health overall.
And just people get lost in this conversation a lot. We have a lot of female patients too, and there's a lot of female patients that come through the door that are. I'm sure you can agree with this, Ashley. We're starting to see patients that are younger and younger and younger and younger. When I first started in the industry, my average patient age was like 44 years old. I'm sorry, my youngest patient was between like 35 and 40. Now we're seeing patients that even haven't abused testosterone, male and females, that are experiencing. I mean, I would say our biggest chief complaint is I'm exhausted all day. I'm exhausted. I hear that so much from men and women, and I never want to lose sight of the fact that we have the ability to treat very well both male and female patients. And a lot of times, which I'm sure you're starting to see a lot more of, Ashley, people are coming through the door as kind of like a team. It's a husband and wife that are doing this together.
Yeah, yeah, it's been great. I love treating females because I'm one and I know how every single month and everything goes for a female. It can be, very much of a roller coaster for females. I just had a little baby, Henry, about 6 months ago. And
Congratulations.
and I know hormones for females can be very up and down. Premenopausal, PMS symptoms, postmenopausal, they're all, important to your everyday life can cause, that low estrogen and progesterone can cause the fatigue and difficulty sleeping, hot flashes, night sweats, painful periods, things like that. And it's just important to know that there is a way to treat this and you don't have to be miserable, every single month or postpartum or premenopausal. There are answers for you and it's good to seek help and there's supplements out there and yeah, important to get checked out.
So when you're on the phone with a male or a female, um, and you're going through their protocol, can you kind of explain what they will kind of experience as you're going through the blood work and explaining their options? I know all the NPs and PAs do things a little bit differently, but you guys are pretty much all on the same page. People that might be watching this is somebody that might be having a visit with you tomorrow, just so that they can prepare and be ready for what to expect. And I mean, I know how thorough you are. It's a 26 to 28 panel poll. Are you going line by line, explaining everything? Can you talk a little bit about that?
Yeah, so definitely very, 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 very thorough on the labs. Female labs are slightly different than males. I'll start with the female lab panels here, but basically we start out always checking your glucose, A1C, looking for any risk of diabetes. From there, we go down to your BUN and creatinine, that's your kidney function. Make sure that's under control. If you're taking any sort of creatine supplement, we make sure it's not putting any harm to your kidneys. They're filtering okay. We check all of your electrolytes, sodium, potassium, make sure all those are within range. We check your liver enzymes. Um, After that, we do a full cholesterol panel, full thyroid panel. Thyroid, I think, is really important with females because oftentimes with the hair loss, or fatigue, weight gain, the thyroid can be slightly off. And oftentimes it's not, diagnosed as hypothyroidism, but it can still be a slightly sluggish thyroid where we have different options like thyroid support supplements that can actually help, you know, optimize your thyroid so you are feeling 100% there. Um, we check a cancer antigen, it's looking for any sort of ovarian cancer, malignant disease.
CA-125.
Yep. And
And
then,
talk about why that's so important. I was really hoping you were going to hit on that. So I have probably seen over 100 different blood works from 100 different HRT clinics, and I've never seen it on one of their panels.
yeah, it is
Why is
very,
that so? Why is it so important?
yeah. So I agree. I love our lab panel because that's one of the many lab tests we do that is never tested in primary care or even with other, OB specialist or gyno specialist. Cancer antigen it's a marker if you have any sort of cancer cells in your body, specifically ovarian cancer. It's nearly impossible to detect symptom wise
Yep.
until you're stage 3, stage 4. I would say ovarian cancer comes on, you might have some bleeding maybe later in life, but like I said, it's usually symptom wise detected so much later that this is such an important lab that is just, it's rarely checked on females. And I'm so glad it's a part of our panel. And I know we've helped many, many women just to do further testing and, support them if this is elevated at all.
Have you firsthand experienced anybody that actually had ovarian cancer yet?
From our patient wise, I have not.
So
Seen,
we had somebody three weeks ago that called me. Her husband was on the phone, and they were both in tears. One of our PAs caught an elevated level in CA-125, and she had stage 1 ovarian cancer. They removed everything, and she was at her general practitioner, saying, "I don't feel right. Something's not right with my period. I've never bled like this before, ever, ever, ever." The doctor said, "You're fine, you're fine, you're fine." They ran testing on her. "You're fine, you're fine, you're fine." Came to us, and it turned out that she had ovarian cancer. This was like 2 weeks ago. And that's not the only time. It's happened quite a bit.
Mhm. Yeah, I think, it's
Even if
hard.
it's not, even if it's elevated, you owe yourself the time to just go do some more testing. We don't offer the additional testing, but we can say, "Hey, you're a little bit higher than you should be. Go check it out." It's just like a PSA level for a male.
Yeah. Yeah, totally agree. I mean, that's pretty amazing that we have caught many over the years. And, I think it's an important thing to check, especially, if you are symptomatic and not getting answers from your other providers. We're happy to check these levels and see and confirm that, you know,
So getting back to the blood panel, you ended the cancer screening, and then obviously then all the hormones that you get into.
yep. Yeah. So after the cancer screening, yeah, then we check the testosterone, progesterone, estrogen, your LH, FSH. It's important to know when your cycle started, when you last had it, because these labs can really vary based on where you're at in your cycle. Um, for females, I often recommend a supplement called DIM, which basically helps support healthy estrogen in the body.
Mhm.
Um, Oftentimes with moodiness and irritability and PMS symptoms, it can be caused by having that kind of nasty estrogen in your body. There's good estrogen and there's bad estrogen. So it's important to make sure, you're supporting that healthy estrogen in your body. So those labs can vary very greatly, just basically your age and where you're at and your
Mhm.
history. So yeah, that's pretty much our panel.
And then obviously IGF too, insulin growth factors for people that are maybe having a hard time with cell regeneration or experiencing sleep issues or some muscle wasting. The IGF-1 kind of tells the tale there if they can, if they're in a good place to be able to receive any peptides that might help with that type of stuff too. How about the male panel? Pretty
Sorry.
similar. How about the male panel? Pretty similar, but
Yeah.
I think it's 26 panels versus 28, right?
Yeah. The one Additional one I wanted to mention is prolactin
Oh,
levels.
that's a good
Also,
one.
yeah,
Because I think we just added that about 3 months ago.
yes, 3 to 6 months ago, I think it's been a great addition, especially this day and age.
Educate me on that, please. Please
Yeah,
educate me on that because I know almost enough to be dangerous, and I know you know way more than just to be dangerous. So I want to hear about that.
yeah. So prolactin levels is looking for an increase in your prolactin levels in males can indicate some type of pituitary adenoma. Oftentimes, this is correlated with a low cortisol level, which is your stress hormone. We also check that. And checking that stress hormone is looking for basically how your body can handle any type of stress. Your prolactin levels can skyrocket if you have any type of pituitary adenoma. People
Hmm.
are often seeing these, and um, they can be treated oftentimes with just a medication. That's also something we would refer out, but it's something that is not often tested. And if people are feeling crummy and muscle aches and fatigued all the time, and they don't know what's going on, and oftentimes it can be due to this pituitary gland and your prolactin levels being elevated.
And guys, just so you're aware, it's very important that you are telling our medical team if you are taking anabolic steroids because there are anabolic steroids that can really play with that prolactin level, and it can show for instance, tren, equipoise, anavar, and I believe anadrol can screw with that level and actually give you actually suppress the pro. Is it a suppressed prolactin level that makes you feel fatigued?
It's when your
It's
prolactin levels are elevated.
elevated, so it can actually elevate prolactin. From what I do believe, I might be wrong with what drugs they do it, but there are some anabolics that will do that. And once you come off of them, that comes back down. So you have to be very careful and very honest with us if you are taking black market steroids, guys. I've taken every black market steroid under the sun. I choose not to live that way any longer because I don't want to risk anything. And I haven't taken anabolics in a long, long time. But if you are taking them, it's okay. We're here to educate you and help you transition to do things the right way under supervision, monitoring things, making sure that the drugs that you're getting are really what is inside the bottle. Anybody can make a label and put whatever they want in it. They can take kitchen, cooking oil, throw it inside a 10 ml vial, slap Cypionate on it, and sell it to you, and you don't know the difference, right? So, with coming through core, it's very important that you're honest and upfront with our NPs, PAs, and doctors for us to treat you properly. Because the last thing we want to do is treat you for something that's really only there because you're elevating it through a different source.
Right. And I can tell you, as a healthcare provider, we have seen every single thing. Everything is HIPAA compliant. Your everything is safe with us. It's important to know what's your history based on, you said your prolactin levels can get out of range, your liver enzymes. Whereas, if you're not telling us the full story, it's tough to say what's causing these issues. And we can dive down deeper paths, but having the full history and knowing you can trust us and it's really important to your medical history and your treatment plan.
One other thing too, Ashley, and which I've seen a lot, is the black market stuff really screwing with men's thyroid. I've seen that quite a bit, which they're completely out of whack. And I mean, and so and the last thing you want us to be doing is to not know that you're on a cycle of something when you come to us, help you get your thyroid treated, right? And then you come off that drug, your thyroid was really okay. It was just a false reading because of the drugs that you're on, and then continue to treat you for a thyroid when it's not necessary. So one of the biggest battles that I have here at Core Medical, Ashley, is that we have patients that come through the door and they're just scared that they're going to get in trouble for whatever reason. And it's just not the case. We're not tattletales here. We're here to help you and get better, make you a better person, make you a mother, a better father, a better dad. And like those are the goals here. And we understand that firsthand that people want to look the best that they can look, and sometimes they take risk when it comes to that. And you can still look amazing and be honest with us, and you can have someone like Ashley on the phone to really get down to the nitty gritty and like what is going to help you achieve the best results. And it's amazing. I mean, I get so many compliments about you guys on like. Before I finish, Ashley, how long do you spend on the phone with a patient that came aboard to Core for the first time? Like, what is that? What does that first visit look like? Time was.
Yeah, I would say, when we go through medical history and like you said, just being open and telling us everything, I would say probably at least 30 minutes per patient. Some people, have busy lives and they're in
Hmm.
between during work and in between meetings, and they want to run through things, and we're happy to kind of be on your schedule as well.
Hmm.
Feel like we're accommodating and can help you with what you want to go through. But I would say with the intensity and details of our labs, going through the labs alone takes 20 minutes.
Okay, so um, really quick here. So you've worked in a physician office where you're seeing patients face to face like all day long, correct?
Oh yeah. Yep.
Okay, so let's talk about telemedicine versus face to face. And every single person that comes through the door, Core Medical Group, is required to see their general practitioner or some type of practitioner to get a stethoscope put on them, hands put on them, pulse put on them, and that must be in their chart.
Yeah.
Going through the process here, Core, we can talk about that in a second, but. I was on the phone with one of our patients, and they brought this to my attention, and I want your feedback on this too. So, when you would work in an office setting where you'd see patients face to face, would it be fair to say that most physicians are at least 30 to 40 minutes behind?
Always. I was going to say, I feel like that's one of the biggest issues. I went to a derm office, a month or two ago. I was in the waiting room alone for an hour before I was even brought back.
Hmm.
And, time is money, time is important. And I think that's one of the beautiful things of telehealth is that you're not sitting there in our virtual waiting room for ever more than 5 to 10 minutes.
So, this is the experience that this gentleman he kind of placed out for me. I walk into XYZ GP office to go see my general practitioner. I'm in there for a physical. There's 7 people to my left that are sick. A guy to my right with a cut on his hand, and then 5 or 10 other people there for whatever reason. I have no idea. But I'm sitting in that waiting room now, hoping I'm not going to get sick because everyone's coughing and sneezing for about an hour, right?
Mhm.
Then I get up, and because they call my name, and I'm like, all right, sweet, I'm going into the room now, just to wait for another 20 minutes in a room with with the temperature at like 65 degrees because they're trying to kill whatever germs they can in the place so they don't get sick. Then a nurse, then an MA comes in, maybe goes to draw my blood. They miss like 6 times because guess what? It doesn't matter if they miss or not. It does matter at Core Medical if we miss, because if you come to one of our offices, which we have 4 right now, this is not medicine to where like you're required to get this done. This is selective medicine. So if Ashley comes to the office and Jessica stabs her 7 times, Ashley's not coming back here to get her blood work done ever again. So we just lost that patient, right? So the experience is at the GP's office, you need that done so they have someone in there who's brand new, never done it. You're a test dummy. So you're getting stabbed 2 or 3 times. They finally get your blood, whatever it may be. And then you go back in the room and you wait for another 20 minutes. And then the doctor comes in, spends 10 or 15 minutes with you. They pull a CBC comp metabolic panel, which is what? Nothing, right? If your white blood cells are elevated, they'll call you back and say, oh, there's a little bit of a concern here, but blah, 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 blah. So now by the time you're done here, you've experienced the risk of getting sick. You've experienced waiting a long time, losing money, being stabbed a couple of times, and frustrated as hell to see the doctor for about 10 minutes.
Yeah, I think it's modern medicine obviously has its issues. I think that's a big one is the waiting rooms from the provider side of view.
Yep.
It's frustrating being a patient, but from the provider side, as far as working with insurance, you know, they schedule us every 15 minutes. You have a patient every 15 minutes. It doesn't matter how much they want to chat, what's going on. So from the provider side, it's impossible to not get backed up. Also, it's going back down to insurance where, insurance wants you to ask all these questions, and they want you to, you get bonuses based on if you're prescribing different medications for anxiety and blood pressure and things like that. So they really push you to prescribe medications, and insurance gets a kickback every single time. And it's kind of just a nasty cycle in modern medicine where sometimes just stepping away from your insurance companies and doing cash only, you really get to see the full picture. You're not going to see anything negative coming from that.
So, I mean, with that being said, I mean, the VA is a perfect example of like vicious cycle of devastating families and people from their prescribing platform. Like, I mean, how many people have you had that came in through that's a veteran that they've been on like 6 or 7 controls, and you're just like, what the fuck is going on here? And the worst part is that everybody gets freaking 6 milligrams of Xanax a day. So they're so they're just like married to the VA now, and they're just married to that vicious cycle of prescribing. And guys, just I don't talk about it as much, but I do. General practitioner's office, just like Ashley said, are bonused, significantly bonused for the prescription base of things like that as well. And these big drug companies will come in and say, prescribe a lot of this, and you'll get a check for $100,000 at the end of the year. Whatever, right?
Yeah. And I think one of the other issues, even if you just start with one medication, your cholesterol's at 205, 210, and you start on a statin, and then all of a sudden you start getting achy joints, and they're like, oh, well, let's add on meloxicam. Okay. And then you have GI issues. Okay, let's add on Pepsid. And then it just gets into a really nasty cycle versus
changing your diet.
Changing the diet, getting the root cause of really what's going on, and doing an extensive lab panel, which unfortunately that goes back to insurance, and insurance just would never cover an extensive lab panel like we do.
So you're looking at our panel is about a $2,700 panel. If you were to use your insurance, they wouldn't cover 90% of it, 80% of it, whatever it is. I've seen one insurance company cover the whole thing since I've opened. And we get the panel anywhere, depending on the situation, between $299 and $399 for that entire panel, right?
Yeah. And I think one of the other points there is that you can ask your provider, hey, can you check my testosterone and this cancer antigen and my prolactin level? And they'll say, sure, but I don't know if it's covered by insurance. You might get a bill for $300. It's going to vary.
Yeah, one of those panels is actually $300 or something along those lines, through the billing of insurance. And, one of the things, Ashley, I'd really like to talk to you about it when I haven't done it with anybody else on here, and I really should have. We get a lot of pushback on the onboarding side of things, that like a guy will be on the phone with like a Mike Bassett. He'll be like, yeah, I got to talk to my wife first. Right. And you having the background of medicine that you were in, my response to that person is, well, if you were at your general practitioner's office and they had some concerns about the symptoms that you're explaining to us, would you have to call your wife and ask, can I spend $299 to see if I'm in good shape or not? And I can keep providing for for our family and play with our kids and maybe not have, testicular cancer, or like, do you need to make that phone call if you're with your GP? No, but what the crazy part is the GP doesn't even give a shit. They're not even testing. We are, right? So I understand people that want to communicate with their wife. Some people do it better than others. I need to work on it. But when it comes to my health, I'm not asking another human if it's okay if I make sure if I'm healthy or not. It's like the most wild thing in the world to me. And it's especially like as I work really, really hard, right? And I provide for a lot of people, and I love it. Like, I love to help service other people and be of service to others. And I can't do that if I have to spend 6 months in the hospital. I can't do that if I have to come off my testosterone. Like I can't. So, what's a message out there to those people that to kind of understand why this panel is like so, even if you don't take the testosterone, like the panel's so important. Like there's,
Yeah.
and then what happens too, Eric? I mean, Ashley, is that the husband gets it done, and then they see a life changing thing happen in the household, and then what? And then what happens?
Yeah. And I think an important thing to always that I tell patients is this, this doesn't have to be lifelong. You can just try it out, see how you feel. Like you're not going to have any negative side effects. You're just going to go back down to your baseline, how you're currently feeling. I think that's an important part of our treatment as far as, talking to significant others and everything. Like, it's important to keep up with them and let them know what you are spending money on. But like Sydney was kind of talking about, when it comes down to it, your health is your number one thing. You could spend longer time with these people, increases your longevity. It helps with, your day-to-day living, your energy levels, your sleep quality, makes you a better dad and son and brother and husband. And it's such an important part of your everyday life that, it's a non-negotiable in my opinion. And another part of our labs is that, you can talk to your primary care about checking these labs, but if they've never seen a prolactin level in their life, or they don't test these at all, like they'll be like, I guess it's fine. I guess it's within range, but really we have specific optimized levels that maybe show in range. But if these are on the higher end, there's treatment. We don't want those to just keep slowly creeping up over time. We always pull up your labs from the previous year. So that way, we can see if it is moving in a trend, not just, there's a red flag next to it. It's always, each specific lab being optimized, comparing with previous years, and making sure, we're getting you your most optimal levels.
One more point that I wanted to make that was super interesting. When I started in this industry 15 years ago, actually, it would take me like 2 hours to onboard a patient, like educate them what's going on, show them data. Now it's like, all right, I want this medication. I want this medication. So I had this guy, a veteran. He was with the agency, and he was in he was like 55 when he called us. This is like 2 months ago, and he's like, Sid, I feel like shit. He came from another guy, and he's like, my wife's really worried, about me taking steroids. I'm like, you're not taking steroids. We don't want you taking steroids. This is testosterone. Your body produces it. Mel Chansey has a saying to when someone's like, my wife doesn't want me taking steroids. And Mel goes, well, neither do we. You can't test for equipoise. You can test for testosterone. You can't test for tren. You can test for testosterone. You can't. So your body's already producing this. It's like being insulin deficient, right? So very similar. So the guy's like, well, man, from back when I was a kid, even testosterone, I'm afraid like, is it going to take time off my life, blah, blah, blah. But this guy was like so in the dirt, like just 105 test level, has been through so much trauma, never taken steroids in his life, 55 years old. His kids are getting older. He's like 22, works hard as hell all day, like with the agency, comes home and just like crashes out, gets up at 5 o'clock in the morning, drinks 10 coffees a day, and the energy drink, blah, 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 blah. So I finally talk him and his wife into allowing him to try 10 weeks of TRT to see what's going to happen. I'm telling you, I get a phone call at 6 o'clock in the morning on like week 6. And he's like, Sid, I'm 50 years old. If I was meant to die without this drug at 90, I don't care if they take me at 70. He's like, I will be able to experience so much more the way I feel right now than with me not being on this. And I'm like, well, so-and-so, you don't have to worry about that. That's going to have no factor whatsoever in when you die and when you don't die, as long as you're not abusing it, you're staying on top of your blood work and paying, good attention to that, which I'm sure you will. And I mean, this guy was in absolute tears, and this is a badass motherfucker. And he's like, dude, this is like amazing. He's like, so, and then the wife calls, and she's like, you gave me my husband back. Thank you so much. We can go for walks at night now. And it's like so fulfilling. And I really urge people out there that, feel like they're bothering me. You know, I get DMs, hey, Mr. Gordon, is it okay if we ever talk sometime? Like, I just want to show you my gratitude. No, man, you can find my phone number pretty much anywhere. Call the office. I'll talk with you. I love those stories. And I know you guys love to talk a little bit about like when you see someone the first time and then see them again the second time, because I know you've experienced that.
Definitely. I mean, the big thing with new people is just you don't have to live your life miserable. You know, you don't have to be tired all the time and fatigued and decreased libido, things like that. So, you know, you can take the first step and just get labs and see where you're at and get a baseline to at least know, but just know, you know, it's not normal to have a baseline of constant fatigue or sleep quality and just feeling crummy all the time. And that's not how you should live your life. You know, life is short and it goes quick, and there's no reason to be suffering every single day. Um, Back on your other question regarding just your, sorry, what was
Like,
your,
so when you have a patient come through the door, let's just say today's
oh
June,
yeah, like how
today's
they are.
June 3rd. Yeah. And then you see him 8 months later again. What are some of the experiences that you've witnessed over the 20 minutes, 30 minutes you talked to them the second time?
Yes. So, you know, we have their full history there and, you know, all of their symptoms from when they first came in. And I first say, oh, how's this going? And this symptom and this symptom. And they're like, I almost forgot I even had any of that going on.
That's the best.
Yeah. And, you know, we look at specific numbers. How many hours of sleep are you getting at night? On their previous history, I had 3.5 to 6 hours, severe difficulties, restless. And they're like, oh, I have 7 to 8 hours of sleep, no issue. And I'm
Hmm.
like, yeah, that's what was written down 8 months ago. And people are just so grateful and so thankful and just feel like, you know, they have their life back and can really feel they're optimized and best.
The the great thing is that so Core Medical still has its first patient from like 15 years ago.
Yeah.
And he is 73 years old. And if you looked at his blood work, it is like it was like okay for the first year, better the second, third year, and like spectacular. Like this guy's aging and his blood work's like staying consistent. And I mean
Yeah.
aging by 15 years. Um, and he's like a big cheerleader for Core. And he looks like he's like 60 years old.
Yeah.
He works out every single day. He's up at 5 a.m. And it's like how could you not want to have this dude's life at like 72, 73 years old? Because if you guys are aware, that's like an average lifespan. Like that's pretty much the average person passes. I think what is it? It is 72. Is it or 71? Yeah. So I mean, there's just like, and I'm telling you right now, this guy's got another 20 years easy ahead of him. Um, and it's been amazing. And just to be able to see that progress and have that progress part of Core is huge. So
Yeah.
before we wrap up, give us a message out there to people that are kind of on the fence, coming through the door, or people that are maybe a little scared to take that first step.
Yeah. I think the big thing is just going back to, you know, you don't have to live your life miserable every day. If you're tired, decreased libido, um, achy joints, pain, poor sleep quality, that's not how your everyday life should look. Even if you're 60, 70 years old, you know, you can still age gracefully and not be in pain every day. And, you know, just taking the first step of getting your labs can really change a difference in your day to day life.
Well, Ashley, thank you so much for coming on today. You did absolutely fantastic, and I'm very grateful for you. And guys, if you're watching this video prior to your telehealth visit with Ashley, please come prepared. Have a list of like all the meds that you're taking, all the meds you have taken. Fill out your waivers completely, and that just goes for anyone that you speak to at Core. If you're going to take the time to go on this journey with us, just make sure that we can fill in the holes to the most of our ability to give you guys the best results, because that's our goal here, which is really in a really high level customer service experience at Core Medical from the time you come through the door to the time that you get your medication. So we really appreciate you guys out there. Ashley, once again, thank you so much. And congratulations once again on the baby. I hope you're starting to sleep a little bit. And we really appreciate you.
Of course. Thanks, Sid.
All right, guys. Thank you for your loyalty, your support. Have a great day.